Wendell Potter, P-O-T-T-E-R.
I'll never forget that day. That was that made a big difference. It honestly did. My email was unbelievable. It was almost like after that they just started rolling in, and my phone was ringing off the hook. And that just again points out how important it is to become the squeaky wheel.
And for people inside, you know, Dan Ellsberg was the Pentagon Papers whistleblower. And he always said what a difference it made to see people outside and how he slowly turned. Were there other people in CIGNA who were talking behind the scenes saying, what are we doing? I mean, they have families. They get sick.
It happens. And we had those conversations often, private conversations within the organization. And many times we were instrumental, I'd say we, the folks of us who were in the public relations or public affairs area, we would counsel the CEO and others that you need to take into consideration the public relations consequences of a particular course of action. And that sometimes would lead to a reversal, and as we've seen, it has in many times. But there are people who are just like me. They and you. They're compassionate people. They want the best care, but they are kind of stuck in jobs that pay them quite well, and they don't really have the ability to influence outcomes necessarily.
The proposals that have now, parts of the law that have gone into effect, for example, kids going on their parents' health insurance until 26. This is a question from Facebook. Can the Republicans repeal the new rules eliminating pre-existing clauses, conditions clauses?
Those are the kinds of things that Republicans will probably go after, the consumer protections. They will probably be siding with what the insurance company's rhetoric is, that we need to have more what they call market-based solutions and fewer regulations. I don't think they'll be able to strip out the prohibition against pre-existing conditions, because it is something that I think most of us really need to realize does indeed keep so many of us from getting any insurance at any price. But those are the kinds of things that the Republicans will undoubtedly go after, because of the things the insurance companies don't like.
Are there similar cases, another Facebook question, where families don't go to the media?
Oh, many times, and you never hear about them. They never came to my attention, but this goes on all the time. There are people who are denied coverage for life-saving treatments, and these decisions are made by someone who often, as in Natalie Sarkeesian's case, is 2,000 or 3,000 miles away and never examines the patient directly. So this happens every day, day in and day out, and it's just the occasional one that gets the media's attention.
Talk about your trip to, was it Wise, Virginia?
It was Wise, Virginia. I grew up in a fairly remote part of East Tennessee, and Wise is near the Virginia state line. Wise County is just a few miles north of where I grew up. And I was back home visiting my family in the summer of 2007, picked up the newspaper, read about an expedition that was being held at the Wise County Fairgrounds, and I was intrigued by it. I borrowed my dad's car. It said that people would be coming from 400 or 500 miles away. They'd be driving from Ohio or South Carolina, Georgia, to be able to get free care that was being provided by doctors and nurses volunteering their care. So I was curious, and it was a life-changing trip. And that decision I made was one that would set me on a different course.
Talk about it. So
I drove up there. It was about 50 miles, and I got to the fairgrounds. The parking lot was jam-packed. It was a rainy day. I couldn't see any activity outside the fairground gates. Once I went inside, it was such a stark contrast to what was on the outside. People were lined up by the hundreds, standing in long lines or sitting in long lines, many of them without shelter, in the rain, getting soaking wet, waiting for hours to get care that was being provided. In animal stalls in many cases, and in barns, and under tents that have been set up like MASH units at a war-torn site. And it was just so startling for me to see that. I realized when I saw those folks that many of them could have been people I grew up with. My relatives could have been there. And they were people who I learned later, most of them have jobs. They just don't have jobs that offer insurance benefits. And a lot of them do have insurance, but they're in these new kinds of plans that insurance companies are pushing more of us into that have such high deductibles or limited benefits that we can't get the care we need, even if we're sending our premium dollars in. When I saw that, it was almost as if I was supposed to be seeing something like that to jolt me out of the complacency that I'd been in for all these many years.
In fact, you have a chapter in your book, Remote Area Medical in Wise County, Virginia.
Yeah. It was a life-changing experience.
And here you were flying around in the corporate jet next to the CEO. I
had been doing that for years and not giving it a second thought. About 2 weeks after that experience, I knew when I saw that I wasn't at all comfortable with what I was doing. I was having misgivings in the first place. I was having the beginning of a crisis of conscience for other reasons.
The gold rim china didn't calm you down and when you were being served lunch in the corporate jet?
It didn't. No, and what you're referring to is a trip I took on a corporate jet just a couple of weeks after that experience, flying from Philadelphia, where CIGNA is based, to its healthcare operations in Connecticut. And we were served, the CEO and I, lunch on gold rim china. And we were given gold-plated flatware to eat it with. And we were sitting in a very luxurious leather chair, flying in a corporate jet that cost $5,000 an hour to operate, or just the jet fuel alone was $5,000. And for the first time, I was paying attention to what I was doing, and I realized that the people in Wise County and elsewhere in this country were in the predicaments they were so that I could fly around in such luxury to get from one place to another.
Who was the CEO you were having lunch with in your jet?
Edward Hanway, Ed Hanway. He was the CEO for a number of years.
Did you share your thoughts with him?
You know, I didn't. I didn't have, looking back, the courage to do some of the things that I really felt I should do. I did begin talking to my colleagues and eventually to my boss and made it clear that I had had a good run at CIGNA. I didn't do this because I had an axe to grind with CIGNA, to tell you the truth. It was because I became so aware of the industry's practices. What CIGNA, as Natalie Sarkeesian's mother said, it's not just CIGNA. It's every private insurance company that engages in these practices and that contribute to the problems we have in this country in our healthcare system.
I want to turn to another question from Facebook. They are pouring in at facebook.com/democracynow, which is always a sign of a good book. Michael Sinan has written in from Astoria, New York. Are insurance companies still able to drop people or deny treatment under Obama's plan?
Ultimately, they will not be, unless there has been some evidence of fraud or proof of fraud. What we have now is a system in which insurance companies, if they don't want to pay your claims and you've bought your insurance through what's called the individual market, if you get sick and you have medical claims coming in, they can go back and cancel your policy. And they'll return your premiums, but they will refuse to pay for any of your medical care. There was a woman who testified before Congress about this practice. It's called rescission. And she was in the midst of treatment for breast cancer when she got notice that her insurance was being covered and she was going to be left to have to pay for all of her cancer care. And the reason was because she presumably had forgotten to note on her application for coverage that she'd been treated for acne in the recent past. And they felt that that was justification enough, that she had not disclosed everything about her medical care. And so they used that. People in insurance companies were paid and have been paid bonuses for being able to find reasons to cancel people's coverage. The legislation will outlaw that, and it already has, unless someone actually intentionally lies in their application, which points out something else about our healthcare system. People are so desperate to get coverage if they have been sick that often they will lie. They will either leave something out or make some intentional misrepresentation because otherwise they can't get care. That doesn't happen in any other developed world. It's insane that we have a system in which people are afraid to tell the truth because they're afraid they won't get coverage.
Another question from Facebook from Fidel Hernandez, who asks, do you fear being jailed like other whistleblowers have been? Are you withholding more inside information in case this were to happen?
You know, it's I've been asked a lot, why aren't more people doing what I'm doing? Well, it's because it's terrifying. You don't know exactly what they're going to do in retaliation, and probably a lot of it is just fear. You know, we all live in fear of retaliation. I certainly was. I didn't know what would happen to me. I know that the insurance industry, it does whatever it can to win and to make sure that it wins, in particular, in the halls of Congress. And so what I was doing was something that could jeopardize their goals on Capitol Hill. So I don't think necessarily that I'm not a whistleblower in the classic, as I guess the legal definition. I'm not disclosing anything proprietary that CIGNA did. I'm just disclosing some practices of the insurance industry that people have never talked about before. And I'm just kind of pulling the curtain back so that people can see the links they go to meet Wall Street's expectations and also to influence lawmakers.
We're talking to Wendell Potter. He was the chief spokesperson for CIGNA, and before that, Humana. And then he turned, and he has written the book Deadly Spin. An insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. We'll come back to talk with him in a minute. Now, democracynow.org, the War and Peace Report. We're speaking with a chief whistleblower, former chief spokesperson for the health insurance industry, the insurance industry's greatest nightmare. He was the spokesperson for CIGNA for years, and before that, Humana. And then through a series of incidents, his own encounters with people without health care, dying for lack of insurance, he stepped out. He quit. And he's written the book Deadly Spin. An insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. Wendell Potter is our guest. Okay, this is Politico today. It says Republican Andy Harris, a conservative Maryland physician elected to Congress on an anti-Obamacare platform, surprised fellow freshmen at a Monday orientation session by demanding to know why his government-subsidized health care plan takes a month to kick in. A congressional staffer who saw the exchange said Harris stood up and asked the two ladies who were answering questions why it had to take so long, what he would do without 28 days of health care.
Isn't that supremely ironic? And he had been campaigning against an incumbent, a Democrat, who was, and he was accusing him of being in favor of Obamacare, and this guy who was elected, who you just spoke about, has pledged to repeal the legislation. Yeah, he is finally, I guess, for 28 days, possibly going to be in the same predicament that many Americans are in for months, if not years. And he was saying, essentially, where's my government-run health care?
Let me ask you a question from Donna Marks. She sent it in at facebook.com/democracynow. She asked, I'd like to know why Mr. Potter isn't naming names of the people responsible at CIGNA for denying claims that kill people. Why is he not shaming people the way he was shamed?